Now we are moving to our English session. Thank you, Sahani sir. Today is our 1742nd day of continuous webinar. Welcome all for our English session. Before beginning the session, we will have a silent prayer. Good evening and welcome once again. Welcome all the participants. Thank you all the faculties for sharing your knowledge, and thank you all the participants for being with us. Actually, your support and presence here is a lot for us. Today's our guest is Dr. Bindu B.R. She is MD in Homeopathy and Center Head of Vidyadhiraja Neurodevelopment Center. Lecture in the Department of Organon of Medicine in Sri Vidyadhiraja Homeopathic Medical College. And she's successfully running a clinic in Trivandrum, Ullur, Trivandrum. And one of the most important thing about Dr. Bindu is she's expert in the management of autism spectrum disorders. And she's really taking care of that. And she's really loving the children and nurturing them like anything. Really, she's doing a wonderful job, and hands off, madam, for your work and dedication for that. And she has, she's having 22 years of clinical experience and 21 years of teaching experience. Really, we are happy to get you as a faculty today. Thank you and welcome to IFPH English session. You're welcome.
Thank you, Rajni. Thank you for the kind introduction. Shall I try to share my screen?
Yes, madam. You are the co-host. I made her as a co-host.
Madam, please adjust your camera a little more. We can see only half the face.
Now, is it okay, sir?
Okay, it's fine now.
Shall we begin, sir? Yes. So today I am focusing on more on neurological disorders. The most difficult cases that we think it's impossible for homeopathy. I am fortunate enough with vaccine. Can you hear?
Yes.
One case of hemimegalencephaly with West syndrome. Another one is kyphoscoliosis, and the last one multiple arteriovenous fistula. So I'm going to present these 5 cases just to show how we can manage these cases where the other system of medicine doesn't have much answer. So first of all, I'm moving to the CJD cases. 2 cases. The first one, this I hope you all know what is mad cow disease. It is Creutzfeldt-Jakob disease. It's the rarest form of disease where when the patient is diagnosed, he or she will go into a coma state, and within 6 months, 1 year. That means the in coma itself they will lose their life. That means there is no scope for the hope or scope for the this disease. This case, he was a gentleman of 50 years old, and he was working abroad. And usually, you know, Prions disease is
Madam, I don't know what is happening in between. Your voice are stucking. It's now I can't hear anything.
2 cases where I am presenting. They didn't have a history of eating meat. They are vegetarian. And the second case, she is not a vegetarian, but she eats fish. But both of them doesn't have a history of eating infected meat. Coming to the diagnosis of mad cow is made from the symptom and from the MRI brain, where the pruning of the brain is seen, and also from the CSF detection of prions protein. And both these cases are diagnosed by allopathic hospitals. And the first case, that is a person of 50-year-old man, and he was showing mood changes, and the patient was taken to Apollo Hospital, and there he was diagnosed with mad cow disease, and then he was shifted to the local hospital, and walking into the hospital, he came back in coma. That was the history the bystanders told. And one of my friends from US, she directed this case to me. I went to Madurai. They were based on Madurai, and I went to take the case. And after taking the case, the medicine was Varatram album based on the objective symptoms and from the past history. We'll explain later on this detail. The potency selected was 6C. Was the diagnosis made by that local hospital, that scan report, and this was the condition. And you can see the case where he was at the when I started the treatment, he was like this, and you can see the myoclonic seizures. This is the common symptom of Creutzfeldt-Jakob disease. The twitching or seizure, jerking of single group of muscles, that is myoclonic seizures. And the patient was in coma. This is after 6 to 8 months. He was able to sit, and he was improved with cognitive ability also. He started crying when he sees his relatives and all. But unfortunately, the patient died after when he reached 1.5 years of treatment after aspiration pneumonia, because they closed the tracheostomy and hole and started feeding orally, but he was affected with aspiration pneumonia by choking of the foot and all. So he died, but still it's a case where we can do miracles. And here, why I went for Veratram, because when I went to the person's home, I collected history from the wife, and she told there was, in Creutzfeldt-Jakob disease, usually there will be a mood change. That will be the first symptom we get in Creutzfeldt-Jakob disease, and slowly the memory will be affected, and they will lose balance and all, and that is the important symptom. And in his case, he was a very lovable person, and he never used to abuse and all. And the lady told me that as soon as he developed the symptoms, just before he developed the symptoms, the mood change was he started abusing her verbally and all. He wanted everything to be kept in an order and all, but whenever there is slight disturbance in all, and he used to shout and abuse. So that struck me. And another symptom I observed was the perspiration on the nose and the upper lip and all, above the upper lip and forehead. And so I selected Veratram and Veratram 6. And she also told one symptom that he was fond of lemonades. So these, based on these symptoms, I selected Veratram, and Veratram 6C was started. And gradually, as the case improved, I increased the potency, and it reached up to 10 so lastly, the case was given 10 And this is the second case. This patient is under my treatment. She is from Kannur in Kerala. And this is a lady of 49-year-old. And she was a homemaker and of one big family, like she lived with a joint family, in a joint family. She was very lovable and all. In her case, the symptom was like her husband told me that he was very jolly, and she was always engaged with the family members, and whenever she finish her work, she will go and sit with the family members and talk and all. But suddenly her attitude changed, and she wanted to be alone, like and some kind of a guilty feeling that because she started losing memory. Like one incident came when the people, when she forgot about some bill or the Google Pay she did and all. From that incident, she she started recognizing that she is having some memory loss, and that made her, what do you say, a feel of she is not good, or she is not performing her duty well, and also she started avoiding people and all. That was the striking symptom, and they took her to the hospital, KMC hospital, and there they did MRI and diagnosed this CJD, and they referred her to NIMHANS. You know that CJD is a case, it's a very rare condition. Only in India, 2 institutes are given permission to study on CJD, that is NIMHANS, and another one is Sri Chitra Institute of Medical Sciences, Trivandrum. So in National Institute of Mental Health and Neuroscience, NIMHANS, they did the CSF study, and prions protein was diagnosed at positive, found positive. So it is a diagnosed case of CJD. This was the condition when we started medication. See the same myoclonic seizures. Here you can see the myoclonic seizures more on the upper limb, and very little was on the lower limb. And the medicine, I started treatment on August 2024, and last month I visited her, and you can see the improvement now. She's far better. She is able to respond to pain. Now the physiotherapist is trying to make her sit up and all. They are giving her a little bit of oral feed also. This is the second case. In this case, the medicine given was Staphylococcus aureus. See, I want to highlight that how important is individualization of symptoms, and how our homeopathic principle guides us. Because unlike the allopathic medication and all, in allopathic medication, if a single case is diagnosed, we will tend to give a medicine which is indicated for that condition. But here, these 2 cases are diagnosed with CJD. Hence, the medicine selected was different. In first case, it was Veratramal, and in the second case, it is Staphylococcus aureus. Because of the mood change, I took the symptom of mood change, like she had a feel of guilt, which prevented her from going into the public or with the family. Then she was a very understanding lady, because her husband was the eldest one, and with his stepmother only all the other siblings, but still she took care of all others. So so in this case, I started with the Staphylococcus aureus 6E, and reached, now we have given 10M. Last month we have started with the 10M. So this is a case of CJD, and now the next case is multiple arteriovenous fistula brain, and this is a condition. See, in this case, you can see that near the nose and all, bulging of the vein is there. Numerous fistula was there. In this case, it started when she was only 9 years old, and there was 1 or 2 fistulas in the brain. She started with some headache and all. They took her, and doing MRI only, they found that there is arteriovenous fistula in the brain. There was only 1 or 2, and then it started multiplying. But she came to me at an age of 23 when I was doing my PG in Government Homeopathic Medical College, and at that time she was brought in a wheelchair, and she was not able to walk or stand, and it was very difficult for her to utter, because she was very desperate. But from taking the history, I understood that she was a very brilliant girl who scored above 90% of mark after having all these things and headache and all. And she was qualified in Polytechnic, and she was with high score, more than 80% of mark. And she got employment in VSC, Vikram Sarabhai Space Center, and she was working there. Got an impression that she will not survive. So it made her depressed, and the symptom I took while taking the case, the symptom she expressed is, I don't have a desire to, like, when I asked what do you want to eat or what do I just want to end my life like this because all my friends are having family and all, ma'am. What is the point in uh, thinking of something about my future life and all? I don't want to live further. So that made me prescribe Oramet, and I started with Oramet 6E and it 6E to 200. But unfortunately, and she started walking also, walking with the what do you say, with walker and all. She was able to walk and all. At about 100 meters, she started walking and all. But suddenly, due to some issues in the home, and she got high rise of blood pressure, and heart fistula ruptured, and that was the end of her life. So we lost that case also. Just to show how we can improve. See here in this picture, you can see that bulging due to the arteriovenous fistula was reduced or completely gone. Now coming to the third case, sorry, I forgot to tell this case. It was a post-traumatic quadriplegia. This was treated in our OPD, in our homeopathy, Vidyadhiraja Homeo College, where the patient was 38-year-old male, and he had a fall from the steps, and he got admitted in tertiary care and diagnosed as traumatic quadriplegia. At that time, the person, due to lack of money and all, one of my friend only took him to our hospital, and at that time he was on urinary bag and all, because he lost all the senses. You know, in MRI report, it showed C3, C4 nerve cord, spinal cord concussion. So he was having quadriplegia, and he was on bag, urinary bag and all. He doesn't have any sensation for urine or stool, and he had repeated urinary infection due to catheterization also. And you can see that this was the condition when he was admitted in our hospital. This is our physiotherapist, and at first I gave Staphysagria 1 and then the fourth day we removed the bag and all. He started.
Maybe some network problem.
Yeah, because of network issue. Please share it again.
So can you hear now? From where
Yeah.
you?
Now it is audible.
So from where till where you heard?
You have given Staphysagria 1.
Okay, after giving Staphysagria 1, we removed the bag and he started.
Yeah.
The urinary infection was cured, and then we started with next day onwards Hypericum 1 repeated dose, and with the help of Staphysagria and physiotherapy, he started walking at in 1.5 months. You know, in C3, C4 nerve cord, spinal cord concussion, usually the fate is like the quadriplegia. The patient is able to move his limb only after 6 to 9 months. But in this case, we are able to make him walk after 1.5 months. So you can see him walking with the help of physiotherapy.
Madam, now we can't see your slides. Can you share it again?
Yeah, please, 1 second. See, after 1.5 months, he was able to walk with the help of physiotherapy. So, from 1M to 10M was prescribed, and he was discharged after 3 months of treatment. And the next case is hemimegalencephaly with symptomatic West syndrome and hemiplegia. Like hemimegalencephaly is a condition where the one side of the brain is enlarged due to collection of water. And West syndrome is symptomatic West syndrome is a condition where continuous seizures will be there, around 80 to 100 seizures a day. And this baby, she was only 2.5-year-old when she was brought to me. Her father was working with my brother, and they were taking treatment from Sri Chitra Institute, but they refused. They told, they advised the parents that there will not be much improvement. Only cutting of the commissures of brain will reduce the seizures. That's what they can do. No other improvement can be done with medication and all. And the child was on 5 anti-epileptic drugs, more than I think 5 anti-epileptic drugs. And I started I think carcinosin, and was the medicine given, and from 200 to higher. I mean, since it was carcinosin, there is no availability of 6E and all, and that was the available lowest potency. So I started with the 200, then went to higher. And from 80 seizures per day, it reduced to less than 50. I mean, again to 25, and she was able to hold her head high, and she was able to move her left hand and leg were paralyzed, and she was not able to move that. But at later stages, she was able to give flying kiss with her left hand, and she was able to kick the ball with the left leg and all. And you can see that this was the condition when she was brought to me. She can't hold her head because of that weight of the brain and all. And even though she was holding that limb, left hand like that, when we asked her to give flying kiss with that hand, she used to give and all. This case also doesn't survive. When a seizure came, and she was taken to the seashore, and she had an attack of seizure and had a choking of food. She was feeding and all. She had a choking, and there was centralized cyanosis. The parents failed to understand that was cyanosis and all. So she was taken to hospital lately, and she passed away. So, but I wanted to show you how we can improve such difficult cases with single medicine and following the homeopathic principles on following strictly on homeopathic principles. And this is another case. This is a case of spinal muscular atrophy, where the child is 15, I think, when he was taken to me, and now he's 18, 19-year-old. And he, at that time, the patient was one of my friend only referred, homeopathic doctor. He only referred this case to me, and boy was 15-year-old, and he was not able to climb steps, and he used to fall repeatedly while playing and all. And they went to the hospital, and it was diagnosed with the spinal muscular atrophy. Now he was able to walk, climb steps, and he is playing football also little bit. And symptoms collected were desire for raw mango, ice cold drinks, aversion to covering, lying in niches position and all. So The medicine selected was Medorinum, and Medorinum 6E to CM was given. Now, the last case, this is a case of neurological issues from kyphoscoliosis. And he also had a recurrent attack of UTI and pain during urination and weakness of leg, aggravation first motion, pain in thoracic spine, while sitting for long time, spelling mistake, sitting for long time, and aggravation from warm application and all. And repeatedly he was operated for this congenital condition. There was thoracic kyphoscoliosis, which with neurological deficit, and so he came to me when he was 21 or and now after taking our medicine without any support, he can go into the train and travel from, he is from Kozhikode, and now he travels from Kozhikode to Trivandrum without the support of his parents and all. Earlier, he was able to travel only with the help of his parents and all. And the medicine given was Natramure, because the main symptom I got, the mental symptom is his only desire is he doesn't want to hurt others or doesn't want to trouble others, and no to the main feature of Natramure, like no to hurt and no to be hurted. That was the main feature, and desire for fish and sweating of palm and face, and he doesn't like conflicts and all. So whenever he get hurts, he will keep a distance from them, but he doesn't have any vengeance and all. So the medicine selected was Natramure, and the medicine seems there is not much other difficulties, physical disability and all, and the emotions were sharp and all. I went for 200 and given 200 to note 10M. I think it's reached up to 50M. This is his voice.
Madam, are you playing the voice?
Yeah, can you hear?
No.
Sorry, it was like he was explaining the whole condition that from birth onwards he was having that difficulty, and from infancy and all, and now he is able to travel. That he was explaining with his own words. So I was not able to. That voice is too low. So with that, I am ending this presentation. If you have any doubt, please.
Thank you. Thank you, madam. You can close your screen share so we can. Thank you so much. I'm truly appreciating your courage and confidence for treating such cases with the homeopathic medicines. And it gives us confidence to take the cases. Thank you so much. And participants, please ask your questions if you have any doubt regarding this. Please come forward, raise your hands and ask questions, please. Dr. Ram Parvesha.
Thank you, Ajni. Congratulations, Dr. Madam. Very excellent session. Neurological problem. Treat very good experience of neurological treatment. So very, very thanks, Madam. Very, very thanks.
Thank you, sir.
Thank you, Dr. Ram Parvesha. And anyone else, please come forward and ask question to doctor. We got a gem here, so we have to utilize her. You can ask questions regarding this. That will help you. Dr. Danesh. If the condition, you are not looking at the condition, only taking the mental symptoms and giving the medicine, right?
Then the physical journals also. If I get
Oh.
physical journals, I will give more importance to physical journals and mental journals.
Okay, but not concentrating on the disease, what it is. Am I
No,
right?
for selecting the potency and follow-up and all repetition and all, we need the pathology. And if ever I need any help of the other accessory management like physiotherapy and all, I will go for that. And in case of any emergency comes to me, I don't hesitate to refer them to the allopathic hospital also for emergency.
So how you selected such neurological cases? How you came to this field? What motivated you? What what is
So the
the
thing is that during my PG in 2015, I started thinking of mental retardation because one of my neighbor, she was elder to me. I told it in previous sessions also. So I wanted to do something for them because I thought if homeopathy is addressing individual, then why can't we do something in that cases and all? So I thought of doing something different from others and thought of selecting mental retardation. But the fate turned around to autism and all. Like one kid an autistic kid came to my OPD for fever and all, but when I gave medicine, his autistic symptoms was also improved. So they told the pediatric neurologist in medical college, Dr. Shahnas Ahmed sir. So he was more than an allopath or a doctor, is a human being because after seeing the result, he referred other patients also to me, and he himself brought his child who is autistic to me. And then I will stop Respiton like medicines which acts on the brain. So I told sir to stop that, and he was not hesitating to reduce that for his son, because when he started reducing that, it flared up, it returned back. So he stopped the medication for his son and told me that he don't have the patience to wait, stopping this and all. So he told that to his patients also. Some of them went back, but some who got results stick to me, stick to homeopathy, and then it got improved. So in my studies and all, in all the 30 cases with CAR scale, all the 15 areas got improvement. And the fact which surprised me is the reduction in seizures and other complaints along with this. So that gave me confidence in taking this kind of epilepsy cases and all. And I don't know what fate brings to us now. So someone referred, and in 2000, even before autism, 2015 or 14 only, I got that case of CJD. So now I think I'm confident in getting any.
Yeah, after treating many cases, now you are into that, the neurological cases and autism cases. Do you have patients with the hyperactive disorder, ADHD?
All the neurodevelopmental areas I have, like cerebral palsy, autism, ADHD, ADD, and
Yes. And for that also you are
conduct
selecting
disorders and intellectual
medicines
disability and all.
with the mental symptoms, right? Do you have any specific remedy?
Like, no, so
Eh,
far, no.
No, you are selecting with the
So far, no.
okay. And anyone else?
And you know, Doctor, because as a organon teacher, if I do such things, I'm not supposed to treat organon. I have to show what I teach in practice also.
Exactly. Most of the organon teachers are good homeopaths because those who are coming and sharing their knowledge here, the organon teachers have, because, we are studying organon for the exam purpose. Then after when.
Can I
Yes,
ask a
yes,
question?
yes, of course. Why don't you raise your hands? Otherwise, I didn't notice you. Okay.
Thank you, Janima. I want to know about how, madam, it was excellent session, and I want to know about how you elicit the symptom of that patient, that staphysagria. How you got the mental symptoms from her? Can you explain?
Yeah, sure. Ma'am, you mean that mad cow disease, no?
Yes. Yeah.
In that case, no, I took all because I told you that they were living in a joint family. Can you hear?
Yes.
Yeah. So they were living in a joint family, and when I asked more about how she was with the family members and all, the husband and the whole family is taking care of her, and her husband is the eldest one, and his mother died at an early age, and his father married another person, and in that stepmother, he got three or four siblings, and telling all these things only, he married this lady, and she was like a elder sister-in-law, taking care of all of them. And even that mother, when I visited the home, that mother was also crying and asking me, can you do something? Can you get her back to us, like that? So, and she was a person, they told that she was a person who wanted to hold all the family together, and she was because she doesn't want any quarrel in the family, and also Staphysagria is like that only, and very
That
loyal to all and all.
was before attack, yeah?
No, that because now she is in coma, no, so we won't
Ah.
get that symptoms in
Okay,
coma
okay.
state. So
Ah.
from the history, in the previous case also, in that case I gave Veratramal. There I told that in that case, when I asked the mood change, here also when I asked the mood change, another striking symptom of Staphysagria was when she started recognizing that she has some issue with her memory, that one day some gas fellow or someone came and she did the Google Pay, but she forgot that she did the Google Pay, and she told her husband that he has to pay and all, but they rechecked and found that she has done it. So that made her like a guilty feeling that she did something wrong and all, but a little bit of loss of memory she recognized, and she kept aloof from the family with that guilt feeling. They told me that she had some or other guilt feeling inside, which made her away from the family and all. So that again is showing the indication of Staphysagria that I took as an indication.
Okay,
So
thank
then
you.
only I selected
How
that
she is
Staphysagria.
now her position, or how she is now?
Now she is better, madam. She is responding with her eyes when doing physiotherapy, and luckily I got one physiotherapist who is a friend of our in our college. We have a very good physiotherapist, Asif. He only referred that neuro physiotherapist in Kannur, and he went there and assessed and doing physiotherapy for her. So we are sharing our inputs and we are doing accordingly. And now she's, according to the physiotherapist, he is responding to pain, and she is blinking her eyes when they told that if she has pain, you should blink. She is responding to that, and she's obeying commands, and she started swallowing food when they give 1 teaspoon of food and like orally and all. I visited her last 2 weeks back.
Okay, thank you, Dr. Jayalalitha. And Dr. Hariharan, please.
Okay, okay, Dr. Bindu. Very nice. I am really congratulating you because you have shown such a courage to take and modify partially or fully in neurological diseases. Because I also treating such cases and I can also modify in certain cases that autism, ADHD, such cases. And one boy, an autism patient, now he is studying at 10th standard. Really, the parents are very, very happy because they came from Amrita Institute of Medical Science, Elamakara, about 5 years back. One homeopathic doctor at Trikunapura referred the case to me. And when he came to me, he looked like a mummy. He will not talk. He has no response. Such a pathetic condition, he came to me. But now he will talk very freely. He will talk Hindi. Hindi. Wonderfully, he will talk Hindi. See, from where he studied, Hindi is from Bengali levels. And now he is studying at 10th standard. Last time, about 1 week also, the parents came to me because he got a diarrhea after taking some എണ്ണ പലഹാരങ്ങൾ കഴിച്ചിട്ട് diarrhea, and I gave the medicine and that also cured. So the school fellows are also cooperating. That is a secret of success because see his class is on the top of the floor, 3rd floor. See, for him, they located his class at ground floor. The teachers are so much cooperating and he is studying well, and that is a happy news for you also. And another boy, ADHD, now he is studying, like he passed SSLC. That is one teacher's boy. She is teaching at the same school. And that I gave that boy Kali Fosuli. That is for 5 years. Kali Fos. Another girl is my patient from Kayangulam. That girl is studying and she passed SSLC and applied for now applied for a job. So you are doing a wonderful work. Really, I am appreciating you, Doctor. Congratulations.
Thank you, Dr. Hariharan. And now I'm inviting Dr. Sindhu. Can you unmute yourself? Dr. Sindhu, you can give your appreciation directly to Dr. Bindu.
Yeah, I was just saying that, it's she has done such wonderful, she has treated such neurological cases, which is very, very difficult, right? So I was really amazed to see the courage and, where to give the treatment to such difficult cases and bring results. That's really a proud thing for homeopathic doctors. So really,
Exactly.
really amazing presentation.
Exactly. Thank you, Dr. Sindhu, for your wonderful words. Dr. Danesh.
Yes. And Dr. Bindu, as we all know, that is doing an excellent work in promoting homeopathy among public, because giving result to a patient is something greater than teaching students. That is the most important point I would like to say, because these always all these cases were shown in front of the students also, so they definitely get the courage to go ahead with the treatment in treating such cases. That's what a teacher can do for the students. Unfortunately, during our teaching time, and we never see such cases being cured with the homeopathic medicine, because our doctors used to practice privately and they disclose what medicine given to the patient and why this medicine was given. Dr. Bindu is a nice person. She is coming forward with the exact medicine and with potency. That's what we have noted in her presentation. Anyway, it's really worthwhile to watch these kind of presentations. We need such presentations so that when people watch all these things, they will know that, oh, homeopathy can do this much of things for patients of this variety. Because they still people believe that homeopathy is for treating fever, cough, eczema, like that. But so much of thing can be done in neurological diseases as well as cardiovascular diseases. Unfortunately, our doctors are not doing all these things for promoting homeopathy. They are simply sitting in the clinic and they're practicing, and sometimes patient may propagate all these things to mouth. But nowadays, that also become less, or very few people come forward with some videos saying that I got benefit from this treatment from so and so doctors. This is it is high time and to present such cases in front of this kind of webinars or public motivation classes. Anyway, congratulations, doctor. This is what I would like to add to you.
Thank you, sir. Thank you.
Thank you, Dr. Danesh. And anyone else? Now it is easy for the students, because those who are coming first, it is difficult. Those who are taking the risk at first, it is difficult. Dr. Bindu have shown the torch to everyone, so they can follow easily.
We have seen some presentation from Dr.
Dr. Sridhara Kurup, sir, you have, please come.
Yes. Sir is there. Okay.
Yes. What is the subject? Sorry, I am not.
Sir is the guest for the next presentation. That's why sir was sir was in another webinar. Otherwise, sir, it is a presentation from Dr. K. Bindu about neurological treatment. Some of
I
her
thought you were
cases.
listening. You are listening that. That's why I.
Sir is the guest sir, in our next session. And that's
Okay. After a long time, I'm seeing you, sir.
Yes. Okay. Continue.
Okay, sir.
is what kind of promotion by homeopathic eternity you get from your college nowadays and from the homeopathic associations, Dr. Bindu?
Sir, I am lucky to be in a college where the management and the principal stands by me. And on the next day of completion of my PG, I asked the management and the principal to start an OPD for neurodevelopmental, and they permitted me. On the next day onwards, I started that. And recently, with one CSR fund, when I asked the manager and the principal about giving space for you know that Vidyadhiraja Homeopathic College has a limitation in our spaces and all. But with that limitation, our manager and the principal permitted me giving some space for the sensory integration park as well as for the center. And now I have started the center with I have 3 staff under me, one speech therapist, one special educator, and one accounts head. And we have started the webinar, national webinar in neurodevelopmental cases for the 10 months. So with the support of the management and the college, I am able to run this. And next, and we are doing one research within India University Center for Biomedical Research, Kottayam. Neurochemists, scientists are coming to our college and collecting blood from the autistic kids. And they are doing research in biomarkers after giving our medicine. And I am going to present next week, this coming 14th in Malaysia, based on the results given by the IUCBR team on autism with our medication, and their evaluation got a wonderful result, and I am going to present in that Malaysian conference, sir.
Yes, yes, Dr. Partha Chakraborty is from Malaysia, and sir has presented some of these, some of such brilliant cases in this forum and previously. So when you meet Dr. Partha Chakraborty there in Malaysia, it will be a great opportunity to mingle with that kind of personalities.
Yes, sir.
Thereby the homeopathy will be beneficiary by sharing the knowledge in between.
Sure, sir.
We are all watching for the news to come from you. What are the things you have done there? You can come over here after the session and after the seminar here, and you can present that paper here also.
Sure, sir, sure.
What is the name of your principal?
Dr. Shalini G. Unitan.
The manager of the institution was our chief
He
guest.
is a cardiologist. He is the
Yes,
cardiologist in
he-
Cosmopolitan Hospital.
he
With
was our
some allopathic hospital, he is supporting these ventures. So that is.
he was here for inaugurating our 1,700 day celebration in Malayalam. Your manager.
Thank you.
And Dr. Tiwari? Dr. Tiwari, you can speak. Please unmute yourself and come. You can share your appreciation directly to Dr. Bindu. I think he's not coming. Those who are coming to ask questions, if you are opening your camera, that will be good for us to see your faces, and we can recognize your face if you are seeing outside from the I mean from the webinar. Outside also we can recognize you. If you are not in a position to open the camera, means it's okay, but even if you can show your face and ask questions, means that will be more friendly. Thank you so much. And I think will do, sir. Thank you. That is your message. Okay. Thank you all the participants for being with us. Such an enlightening session today. She's doing really a miracle in the field of homeopathy. Thank you so much, Dr. Bindu. And we all will be with you in the future. And you, IFPH is always supporting such great personalities and very courageous women also you are. Thank you so much for being with us. Thank you all the participants for your participation. Thank you so much. Now,
a special thanks, Dr. Bindu Madam. Very nice described the neurological case.
yeah.
Special thanks. Thank you.
And now I am inviting Dr. Shaila for moderating Malayalam session. Doctor, you're welcome. And now today we are winding up our English session. Thank you, Dr. Bindu, once again. And thank you all the participants. Good night. We'll see you the same time tomorrow. Bye-bye. And Dr. Shaila, over to you.